Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we're diving into a milestone piece of Pennsylvania medical history. Back in 2016, PA became the very first state in the country to explicitly include Autism Spectrum Disorder as a qualifying condition for all ages.
It really was a groundbreaking move. What we appreciate about the framework at PennsylvaniaMarijuanaCards.com is how inclusive the law is. It doesn't require the autism presentation to be severe to qualify. The diagnosis itself is what opens the door for both adults and minors.
And that inclusivity is backed by some serious neurobiology. This isn't just about calming someone down. There's a disease-specific link between the endocannabinoid system and autism, right?
Exactly. Research out of Stanford and a major 2025 systematic review show that children with autism often have measurably lower natural endocannabinoid levels. The system that regulates mood, social behavior, and sensory processing is essentially running low on fuel. Medical cannabis, specifically CBD-dominant formulations, helps bridge that gap. Let's look at the actual clinical data, because parents and patients want honest facts, not miracles. The 2025 clinical meta-analysis on CBD extracts showed some very clear, statistically significant benefits. Yes, across 3 massive randomized controlled trials, CBD-rich extracts significantly improved social responsiveness, reduced disruptive behavior, and lowered anxiety compared to a placebo. Real-world data from Israel also showed that roughly 83% of autistic patients experienced moderate to significant overall improvement, especially regarding behavioral meltdowns. That's a huge relief for families. But your guide also highlights a 2025 study where CBD didn't outperform a placebo for repetitive behaviors. Why is that honest distinction important? Because expectations have to be calibrated. Cannabis is an excellent tool for managing downstream symptoms like severe anxiety, sleep disturbances, and behavioral outbursts. It is a symptom management tool, not a developmental cure for core autism neurology. Every individual responds differently. Now, let's talk about the logistics for minors. Since children can qualify in Pennsylvania, how do parents actually navigate the legal process without their kids having to go to a physical dispensary? The state handles this beautifully through the designated caregiver pathway. A parent or legal guardian registers as the primary caregiver. They handle the portal, consult with the doctor, and make all the dispensary purchases on the child's behalf. For products, high THC is generally avoided. Dispensary pharmacists heavily recommend weight-based doses of CBD-dominant oils and tinctures for pediatric cases.
What about autistic adults? Their clinical conversation looks a bit different, especially regarding product selection and co-occurring conditions like ADHD.
It does. Autistic adults manage their own accounts without needing a caregiver. However, because many adults also experience ADHD or high anxiety, they need to be incredibly cautious with high THC products. Too much THC can worsen executive dysfunction or paradoxically trigger panic. Starting with CBD-dominant products is still the safest path.
That's a vital safety tip. Another critical area you emphasize is drug interactions. Many individuals on the spectrum are already taking prescription medications.
This is crucial. CBD can moderately inhibit the liver enzymes that break down common antipsychotics like risperidone, as well as certain anti-epileptic drugs and SSRIs. This can dangerously elevate medication levels in the body. You must bring a complete medication list to your evaluation so our doctors can review it.
Perfect. So if a family or an adult patient wants to safely take the next step on your platform, how does the process work?
We've cut out the stress completely. Step 1 is filling out our quick 3-minute intake form at PennsylvaniaMarijuanaCards.com. Step 2 is the telehealth evaluation. You'll speak directly with an expert registered physician, like Dr. Jonathan Chance Miller. His official NPI number and credentials are fully transparent and listed directly on our site for absolute peace of mind. And just like your other conditions, if for any reason the doctor finds that medical cannabis isn't a safe or qualifying fit for their current regimen, there's no risk, right? Exactly. If you do not qualify, your $159 fee is completely and instantly refunded. No questions asked. If you are approved, step 3 is automatic. We submit the certification to the state registry that same day so you can finalize your state ID card. Smooth, transparent, and completely risk-free. A wonderful resource for families trying to ease the daily challenges of autism. Absolutely. If you are ready to explore safe, medically guided symptom relief, head over to PennsylvaniaMarijuanaCards.com. Fill out the quick form at the top of our page and let our compassionate medical team take it from there. Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thanks for listening and take care.